Hi, I'm Dr. Jay Heintz. I'm the Medical Director for Houston Injury Solutions Network, and today I'm with Dr. Cameron Jackson, and he's going to tell you a little bit about himself.
Hello, my name is Dr. Cameron Jackson. I'm with Injury Center of Houston, located in the Greens Point area, 45 North and Greens Road, and we're going to talk about exercises and recovery as it relates to an automobile accident.
Dr. Jackson, I know that you are an expert in exercise and recovery as it relates to auto injury. At what point in the patient's care do you typically start the exercise process?
Typically, right after an accident, the patient's they're in a lot of pain, they're pretty inflamed. The first step is to decrease that inflammation. We do that with several things, ice packs, massage, ultrasound, more of a passive level of care where they're just laying there. We apply the therapy to them to help reduce that pain. Once that pain is reduced, then you typically progress them to more an active stage of care, and that's typically in several stages. We start low in more of a range of motion, flexibility type stage, kind of increase that motion in the affected joints, and then we progress them on at that point.
So typically in that beginning stage that you're talking about where they're real inflamed, is there also medical co-management involved?
There is. We typically refer them out for medical management. Anti-inflammatories, pain medicine, muscle relaxers are typically helpful with these types of injuries. But you don't want to just take medications. In addition to the medications, you have to have some sort of physical therapy to help with the pain and the swelling in the joints themselves. So we typically take care of these issues in a multidisciplinary manner. The medical management along with the active therapy under the direction of the licensed doctor of chiropractic.
So when we put a patient into therapy, is the therapy in the beginning and the therapy at the end kind of the same, or is there a progression of it?
There's definitely a progression. You start more conservatively. Like I said, the patient is laying there. We apply the therapy to them to decrease the pain and the inflammation. As the pain and the swelling decreases and their flexibility increases, we typically, like I said, progress them into a more active stage of care. And you typically get the better results when you start moving them to more of an active type therapy.
So in active therapy, are we talking about resistance training?
It is resistance training. There's weight training. After the flexibility stage, the main thing is to increase the range of motion in the affected joints, the neck, the back, the knees. Once we can increase that flexibility and be it relatively pain-free, then we start moving into more resistance training, weight training, resistance bands, things like that to kind of increase the strength of the muscles along with the increased flexibility.
So there's a lot of buzz now about core strengthening. Can you tell me what core is? Because a lot of our patients, they seem confused over what the core is.
Sure. Core strengthening is a vital part of the overall rehab process when you injure in an accident. You can think of the core as like the foundation of your house. If you have a weak foundation, then that house is going to tumble. It's not going to be stable. One of the main things we focus on when we do the rehab process is increasing your core body strength. That's increasing your abdominal muscles, your back muscles, hips, pelvis, things like that. And if you can increase that core muscle strength, then it basically follows over into every part of your life.
So we know a lot of patients have a weak core to begin with. How does that play into recovery from an auto injury, and why is the core specifically so important?
Well, obviously that weak core didn't cause you to have the injury that you had, but it can delay the recovery that you're looking for after an auto accident. So we try to strengthen that core while you're in the rehab process. Having a strong core like that decreases the likelihood of re-injury. After you finish the rehab process in our office, we want to make sure that the likelihood of you re-injuring that area is decreased. So we teach you exercises to increase your core and exercises you can take along with you at home to make sure that the likelihood of re-injury is decreased.
So you mentioned earlier that in the beginning of treatment, you kind of medically co-manage, you work with other doctors. And somewhere down the line, that may lead to other procedures like an injection, or let's hope not, but maybe even surgery. How does rehab play into those procedures, and what role does it play in the patient's recovery?
So basically, you want to start with the rehab. If you can't decrease the pain, increase the range of motion with the rehab, then you have to progress them into a more aggressive type treatment. That's when a referral to a pain management specialist may be indicated, depending on what the imaging findings show. Especially if they have shooting pains down their arms, down their legs, they may be a good candidate for an epidural steroid injection as an example of one of the procedures a pain management physician can do. After the epidural steroid injection, it's important to have rehab after that. Most of the time, if you have failures after an epidural steroid injection, it's due to not implementing the proper rehab afterwards. And that's what we make sure we do is after you do have an injection, if you do need one, then we make sure you have the proper rehab after that to get the fullest effect for the injection.
So could this be why patients who talk to us and say, hey, I went online and I read about an injection and I really don't want to do it because it only lasts 4 weeks?
Right.
The rehab can help make that work longer?
Typically, if you've really dug down into those reviews that you read online, you kind of realize a lot of those patients were either patients where the injection never worked in the first place, they were probably surgical to begin with, or that they didn't go through the proper rehab afterwards after the injection. You know, you can't have the injection and go home and hope the injection is going to cure 100% of your pain. You have to do the proper rehab after the injection, make sure you get the full effect of it.
So I'm Dr. Jay Heintz. This is Dr. Cameron Jackson. We're with Houston Injury Solutions Network, and we hope that this video helps you understand the role in rehab in your recovery from an auto injury.